Got it. Great. So hi, everyone. Thanks for coming to our quarterly meeting for WyHMAC. WyHMAC is a coalition for the Wyoming Home Modifications Action Coalition. If we go to the next slide, we have more kind of what our vision is for the coalition. So we're working to build up a group that will ultimately render more home modifications in Wyoming, uphold a strong advocacy for home modifications, create a unified care network, create training resources for occupational therapists and handy workers who have been identified as being key players in home modifications and conducting them throughout the state, as well as building a repository of information on a website, ideally, and then conducting some targeted research to see what kind of programs will work the best in Wyoming and benefit the greatest amount of people. So I guess with our goals, we have a couple updates. So for the repository of information and website, we have been working on a website. Bernard is housing that, and there's a link that works on the next slide to get to the website. If you click on that, Mark, you can just show people a brief overview of what we've been working on. This is our freshly minted website, so please check it out, give it some web traffic. It's a great resource. We're still building it, but I think there's a lot of really good information on there. Bernard, do you have anything you want to briefly touch upon with that, or we'll hit it later also? So.
May have trouble with the mute feature, but Bernard, can you hear us?
I'm
Oh, we can hear you, but you're going in and out, Bernard, but we can
in and out here, internet connection. So if one of you wants to go over that, will be fine.
Yeah,
sure. Yeah, I can go over it just in the meantime. So we've built this website, or Bernard has built this website with a collection of information, things surrounding what are home modifications, why they're important, particularly in rural and frontier environments, what the benefits might be. Then we have basic information about what are home modifications, different types, different strategies. So really a good informational resource, and something that we're pretty excited to have put together, just because it's a hub for people to go and learn a little bit more about what we're trying to do here. Yeah. So there's also some information and resources. So these are different like flyers and informational pieces that people can either distribute or just put up or look at for themselves. And these are all just open source, so feel free to print them off. We're hoping to eventually make a packet of flyers to hand out to different senior centers or doctor's offices or what have you that could benefit from the information. And along with these, kind of more marketing-based flyers, we also have a fair amount of information about funding sources, which is really kind of the meat and potatoes. That's what people want, is to figure out how they can actually get home modifications for themselves. So that's a pretty exciting thing, and that's a big change since the last quarterly meeting, something that we've really been working hard on. So very excited to see that go up.
and we'll go over this one later on, so we're going to save that for later on in the presentation. So I'll just jump back here for you.
Great. So if Bernard, your Wi-Fi is working, or Rick, we could go over AgrAbility next. That's another interesting program to be delivered.
Rick is on the line, and if you're there, Rick Geringer from Wyoming Independent Living.
Yes, I'm here.
Wonderful.
Yeah, so a program I was associated with. So first of all, I'm Rick Geringer with Wyoming Independent Living. I've been with Wyoming Independent Living now for 21 years, and we've done a lot with home modifications through our agency, through Wyoming Independent Living. Yeah, we do home assessments. We do evaluations to see what barriers a person has to their disability. only in the home, but in their everyday lives. And so as working for Wyoming Independent Living several years ago, I was associated with this program called AgrAbility. And AgrAbility is a program that works with farmers and ranchers to do whatever it takes to help them stay on that farm and ranch. Wyoming has a large agriculture population, and typically I grew up on a farm. I farmed for several years, and I kind of know the mentality of farmers, and farmers just won't really talk about having a disability. They feel like some things are just harder for them to do, but the project still has to be done. And so, yeah, we try to do what we can to help them stay on the farm or ranch. And I should back up a little bit here. This AgrAbility project was authorized by the 1990 Farm Bill, and it's set up through the University of Wyoming Extension Service. And the program itself has to have a partnership between a land grant university, and the only land grant university Wyoming has, of course, is the University of Wyoming. So the partnership was with the University of Wyoming, with the Wyoming Institute for Disabilities at the university. They have a assistive technology part of their agency, of their that they have. That's part of the partnership that is in AgrAbility. There has to be a land grant university. There has to be an assistive technology branch of that partnership, and then a nonprofit. And the Wyoming Independent Living was the nonprofit part of that program. And so, yeah, a farmer, having been a farmer and growing up on a farm, I know that farmers and ranchers, that's what they want to do. They don't want to do anything else. They don't want to, if they have been in an accident and vocational rehab says, well, maybe you should be retrained for something else. Well, that they won't, most won't want to hear of that. They don't want to be trained for something else. They want to be in agriculture. And so through this AgrAbility program, that program tries to make that possible. So in that program, there's an assessment done on the site, on the farm or ranch, to see what the barriers are, see what the farmer or rancher needs to be able to continue in that occupation. And there could be an assessment, there could be a recommendation for a lift. The farmer might not be able to get this tractor anymore. So an elevator is either constructed or a commercial type elevator to raise the farmer from the ground level up to the tractor level so he can get into the tractor. And just different things like that I helped a farmer once just put some railing on his windrower and a lower step on the windrower, just so he wouldn't have to step up so high to get in up to that first step, and then the railing to help get into the windrower. And so that program is a good program. It's a good program to be able to make that happen for the farmers and ranchers. The program itself is geared toward anyone whose main occupation is in agriculture and farming or ranching. And it also applies to the person's family too. So if there's a family member that has a disability or medical condition, then that AgrAbility program can assist with them also. And so the focus of it is mainly on the actual farm site, outdoors with the machinery, and that's that part of the operation. But still, a farmer or a rancher has to be able to get in and out of their house. If they're in a wheelchair, they have to have a ramp to get up into the house. They have to be able to carry out their daily activities in the house in order to be able to be ready to go out and farm or ranch. So the home modification program still applies in this situation too, just to be able to make sure the person is able to get not only to his ranching operation, but to be able to get in and out of their homes, to be able to function in their day-to-day life. The program, one thing about the program, the AgrAbility itself does not have funding to assist with any of these projects. So there is a need for searching out additional funding opportunities. And that could be done through vocational rehab, possibly. There's a low interest loan available. It's called the YTAP loan, and it could be available. It's good for up to $25,000, and it could be used to be able to purchase larger cost items, an elevator for a tractor, or some kind of an adaptation and controls in a tractor to be able to still operate that piece of machinery. So the funding, there's always a need for funding, and funding, it can take some creativity to find that funding. Sometimes the farmer himself can be pretty creative. Give a farmer, a rancher, a welder, and they could pretty much construct anything. And so the AgrAbility just tries to be able to be there to be able to provide that assistance to get to that next step, to be able to remain where they really want to be. And I think that kind of covers the AgrAbility program. Right now, we're trying to, Bernard and I are researching to see if there's a possibility we could revive that program and get it going here in Wyoming again. As I mentioned, we did not have that program for several years, and so there's a chance there could be an opening. There are some grants available. The grant cycle starts later on this year, so there's a chance of getting into the grant cycle, getting a grant approved to be able to revive this program. So hopefully we could get that program going again.
Great, thanks for sharing that. Sounds like a fantastic program, and I think it's definitely something, many hands make a lot of work light. So I think that'll definitely be something I'm excited to see progress in the future. Does anybody have any questions or tidbits to share about the AgrAbility program? No. All right, then I suppose we can move forward with the Falls Prevention Coalition. This is a group we're pretty excited to have partnered with recently. And so this is Jeff Grant, if he's on the line. I think I saw him pop in. Then he can share a little bit more about that.
I stopped sharing my screen. Jeff, are you ready to present? You can hear us? No, not sure. I see him on the list at the moment.
That I thought I was.
There he is.
Hi, Jeff. Can you hear us?
I can hear you.
Okay, wonderful, wonderful. So let me just, so that should have taken my screen off. And if you, Jeff, if you go to the bottom of the screen, you should see the green share screen button. It should now pop up for you.
Apologize, I brought up the wrong thing first, so I need to go kind of get out of here. And
It's hard to hear you, Jeff.
I apologize.
So there's a lot of feedback on the line. So
Okay. I need to apologize. I brought up the wrong Think First program. So I need to go, excuse me, yeah, I need to go in and get that.
no worries. Do you need some more time? Maybe we can move to another part of the agenda, or are you about to put it on the screen?
There we go. Okay.
Well, maybe whilst we are, oh, you've got it. That's great.
Got it here?
Yeah, we can see your screen now.
Okay, good. Well, good morning, everybody. My name is Jeff Grant. I'm the unintentional injury prevention coordinator for the state of Wyoming. I deal mostly with falls prevention. I deal a lot with evidence-based programs. We do Tai Chi for arthritis, matter of balance, bingo size is one of the new ones that we did. But we also have a brand new program that we're just getting started. It's called Think First. Think First is a unique program. It has modules for every age group, all the way from infants all the way up to older adults. And what it deals with is a lot of traumatic brain injuries. So with younger kids, we deal a lot with spinal cord injuries, traumatic brain injuries, the importance of wearing a helmet, wearing a seatbelt, things of that nature for the younger ones. I'm going to start going into the schools, talking about spinal cord injuries and even the slightest, how much they affect you. Injuries can affect you, long term. I have a friend of mine that used to be my racquetball partner, and he was in a fender bender. And when I say fender bender, I'm talking 5 miles an hour on the car, and he got hit, jarred his spine. He's now been in the wheelchair for the rest of his life, and it has been for the last 10 years. And this is a big, strong guy that, it's just amazing what happens and how fast, things can change in life. But one of the programs we have, Think First to Prevent Falls, is really kind of a unique program, and it talks about traumatic brain injuries, falls prevention, home modifications, things that we can do. And what I'll be doing with this program is I'll be going into senior centers, assisted living centers. Anybody that wants to invite me in, I'd be more than happy to come in and present this. What this agenda kind of shows is the overall picture of the brain, what happens to traumatic brain injuries with falls, the significance of falls, fear of falling. The fear of falling goes right into other evidence-based programs that we have, Tai Chi for arthritis, matter of balance, safety inside your home modifications that we can do. And a lot of us have been in here, we talked about, things on the stairs, rugs, cords, things of that nature. And it shows people how to look for just little things that might cause a fall. Having a nightlight in your bedroom, for instance, that when you get up, we talked about, I think Bernard and I were kind of laughing at as we got older, it's so much easier to see, when you get up and there's just a small light, you can orient yourself to where you are a lot faster than pitch black. I know even me in the middle of the night, I have a bad habit of keeping my shoes off right next to my bed. And I can't tell you how many times I've got up in the middle of the night and I step on my shoes and I trip and I have to brace myself against the door. And then I wake my wife up and she's mad at me. So I've learned to start tucking things under the bed. Or as I should learn. I haven't learned because I still do it. But, other things, community safety, things outside of our house, are the sidewalks, are they slippery? Where we go to shop, is the sidewalks bad? Do I need help? Talking to physicians about medications, vision, even nutrition is something that we want to talk about with older adults. What happens if I fall? Can I get up properly? And the importance of exercise. And I'll kind of go through here and I'll skip. This whole presentation is about an hour long. And we go through each one of these agenda topics. And there's probably 10, 12 minutes on each topic that we can talk about. But I'm going to skip down here and just kind of show you some of the things that we talk about, like safety in the home. And we'll go through each room, the living room, the kitchen, the bathroom, the bedroom, and point out things that might be a hazard to you. In the kitchen, one of the things that think about is chairs with rollers on them. Are they safe? Well, if you slip and fall in the kitchen and you grab onto that chair, a chair with rollers, is that really going to stop you, or is it going to catapult the fall? And so we talk about maybe get kitchen chairs without rollers. A little less convenient, can't move them around as easy. But if you were to fall and grab a chair with no rollers on it, it's going to help you stay stable a little bit longer. Hallways, are there shoes in your hallway? Are there cords in your hallway? Extension cords going across the hallways? Things that we can talk about. walkways and ramps? Do we have railings on both sides? Are they iced over? Is there a way that the water can drain from these ramps and stuff like that? We'll talk about general information, how to carry a phone with you at all times. You know, a lot of times we have aprons that you could, with a pocket, you could put a phone in. We talk about tripping hazards, clutters, throw rugs. Are your throw rugs the old throw rugs that are slippery if you step on them? I know a couple of us talked about kitchen surfing. When we were kids, we used to run and jump on the rugs and slide across our kitchen floor. Well, as we get older, we don't kitchen surf anymore. Now we walk very gingerly. The lighting in the kitchen, the bedrooms, the bathrooms, even have a simple night light on the staircase that you can see down the stairs or up the stairs, whichever way that you're going to go, is a great thing to have. And this goes through each specific room that we have. Things that we talked about with the bedroom, stairs, and just kind of going through these really, really fast. There's other things that we can talk about. Safety outside the home. You know, what angle is the ramp at? Is it something that you can walk up easily? Is it something that you have to pull yourself up at? You know, are you carrying things up this ramp? Do you have railings on both sides that if you might be carrying a gallon of milk, you at least have a railing on one side that you can also grab onto, you know, if you need to. In the yard, a lot of us like to go out in the yard. This talks about how carrying your phone, using sturdy shoes that you have, and using a garden kneeler instead of kneeling down. If you were to fall outside, how can you get up easily? This is just really this goes through, and we have this on our site that you'll be able to go to, but some really great information. We have resources with all this, some really great information that this program provides. And so, like I said, what I'll be doing is going into senior centers and giving this presentation. There's an hour-long version and a 2.5-hour-long version. Let's face it, nobody wants to sit and listen for 2.5 hours. So what I'm doing is I'm working on this hour-long presentation that we can go out in our community and present that. So if this is something that you might be interested in, or know a senior center, an assisted living center, even a library where senior centers congregate. If this is something that you think might be interesting for them, let me know. I would be happy to set up an appointment and figure out when we could get together and I could present this in detail. So kind of a great resource. Like I said, it also has other modules, teen driving, youth, all kinds of really, really great stuff. So this is a national evidence-based program. It's a national base. We are the first ones in Wyoming to have it, and we are the only ones in Wyoming to have it. But you know, when I got involved with this coalition, I thought this is a great avenue to bring our Falls Coalition in with WyHMAC and work together instead of, you know, trying to reinvent the wheel. So we've all kind of got together and worked out some things. And so this actually is a great program. So let me know if you have any questions, and I'll kind of take it back to you guys. I won't do the whole presentation. Like I said, it takes too long to do the whole presentation, but I'd be happy to answer any questions that you might have.
Thank you, Jeff, for presenting that on the Think First program, which I think we can all agree is a valuable resource, and it's the other half of the component of home modifications. It's the behavioral aspect and the healthy sort of environment, and making sure that people are being careful at the same time as we are trying to help modify the home environment. And I know that on the line we do have several senior centers. So if you do have questions or you're interested, you can either directly message Jeff or you can put the message in the chat to everybody, and welcome your questions. But I don't think there's any at the moment, from what I can see.
I might add just real quick, just in case. I know a lot of people don't like to ask questions when there's a whole bunch going on, but my email address is jeff.grant@wyo.gov, or my phone number, and my cell phone is connected to it. My phone number is 777-2424. So if you don't want to talk here but have a question, feel free to call me anytime. Okay.
Thank you very much. So I'll put the slides up for you, Kristen.
Great. Again, thanks for that presentation. Really excited to make that partnership. So up next, we have a cost savings analysis by Bernard. Yeah, so if you want to take it away.
Sure, I have some slides, and I hope that my internet connection is stable. It's telling me that it isn't, and I'm kind of on and off, so bear with me.
If needed, we can present them for you if they're in the shared drive.
Which they are not. I was working on them this morning.
Okay, no worries.
Let's see. Are you seeing my dog or are you seeing my slides?
Seeing the slides.
Oh. Okay. All right. Well,
Yeah, it looks good.
okay. Hopefully this will work. Okay, here we go. Yeah, so thanks, Jeff. It's been really great to have the Falls Prevention Coalition join our coalition. I always think of that being the reason for being for home modifications is trying to improve safety. And so that's been a really important and beneficial partnership with us. One of the things that we're trying to really think about during our weekly meetings is, what is the reason for home modifications? Who do they benefit? And so we're thinking about all the different state groups, thinking about, of course, older adults, and also thinking about the state coffers, as that is also really important to try to think about. Is this something that we can make into a reality and that will eventually benefit the state and our budget? But before I jump into that, I wanted also to mention another one of our vision points, which is to create information and knowledge for stakeholders in the state. This shown in my slide is a checklist that's made available on the CDC website. And we think this is a great resource for people. It does, as Jeff was just saying, walks consumers through the different rooms of their houses and identifies common hazards that might be found. And then the other thing that it does is offers recommendations for how to take care of those hazards. So this is great, but we also recognize that Wyoming is a really unique place in lots of ways, including our environment, our weather environment, climatic environment. And so one of the things that we're in the process of working on now is a version of this that's customized to take into consideration some of the things that older adults in Wyoming might uniquely face. So this will be available on our website. I would say we've been talking about it a while, but I'm hoping that it will be made available for consumers to print out and use in the next month or so, I would hope. I see some nodding of my colleagues, so I think that's a good sign that we're on the same page with that. So look for that. So home modifications and thinking about them is really important, mainly because it's such a common need. According to a study, which I'm going to talk about in more detail, not done by us, but done by a reputable researcher, found that nearly half of homes headed by people 75 and older had problems, accessibility problems. Problems like troubles getting into the home, either because of stairs or some other issue, using rooms that we need to use in order to live independently, such as our bedrooms, kitchens, and bathrooms, and getting to those rooms. So there's a big problem that's been identified, and that is that nearly half of people have these problems that can be fairly easily fixed, or at least made easier through home modifications. So things like adding grab bars, improving lighting is probably the easiest, and then more transformational home modifications like adding ramps or widening doorways so that people who use wheelchairs or walkers can still access all the rooms that they need to access in their homes. So we know there is a need. And we also know that home modifications are effective for people even beyond falls prevention. So for example, we know that home mods reduce ADL, activity of daily living, and instrumental activities of daily living dependency. When people have these problems, that's one of the first risk factors for needing more intense care. And so we know there have been many studies that have shown that home modifications reduce the need for formal and informal caregivers. So much of the caregiving, most of the caregiving by far is done by family members. And if you've ever provided care for a family member, you know that that is one of the most stressful things and really physically exhausting things that you can do. And so home modifications are not only for the individual, but also for people who are helping their family members and their friends and loved ones out. We know from other studies that adding accessibility features such as home mods can lead to a reduction in nursing home stays related to the issue I was just talking about. And then we also can think about home mods as being beneficial for anticipating future need. So sometimes we think of home mods as being preventative, as we should. All of us should be thinking about our future needs, especially when we are active and vital and can make the changes, and maybe our incomes aren't as limited. So thinking about the future is good, but also home mods we know are beneficial for future need in terms of sending people home. So rather than spending a lot of time in a rehab facility, maybe there's opportunities to use home mods to get people home faster and safer. And then the last thing that I always like to mention is how home modifications really align well with our state culture, our cowboy up, independent, take care of yourself mentality, which we are all proud of. And doing home modifications and getting people the ability to take care of themselves and maintain their functioning on their own is also a benefit for us. There's lots of evidence that home modifications are effective for reducing falls, and here are just some of the studies. The results tend to vary according to the population or the sample that's tested. So in the study by Rose here, we see that home mods and home assessment and minor home mods reduce fall incidents by about 60% among healthy people with no functional impairments. So just for the general population, this is a great thing, sort of a universal design type approach. Home assessments by an OT, which we're not really talking about our capable program today, but that is a program that involves an occupational therapist. And home mods reduce falls by 36% of people who have a history of falls. So a history of falls means that they're more at risk for having another fall, obviously. Also, there may be some issues with fear of falling, which can, when people are afraid they're going to fall, it causes them to limit their activities and participation. And so that can have all kinds of ripple effects. And then simple home modifications, such as installing handrails and so on, reduce falls by about 25% for people of all age groups. So anyone can fall anytime. I'm always happy when I leave town and stay at a hotel and there's grab bars in the shower. I don't have grab bars in my own shower. Probably should think about that. But it's an important point that home mods are not just these changes that you make when you need them, because you never know when you're going to need them at any age. So one of the things that we would like to do is eventually have a benefit for the state in terms of their budget. And so we've been thinking about studies that have indicated that that's a possibility, and trying to make a strategy for really bringing this to the state so that we can procure significant funding that would align once again with the state culture that we want to help people to help themselves, essentially. And this is the results of a study done recently by Abraham et al. It was presented at the Gerontological Society of America and has some really interesting insights. So what they try to do is model what would happen in terms of costs if a public funding source put funds forward to start a project. And so what you see here are the columns representing people of different age groups. So we know that one of the biggest risk factors for falls is age, not controlling for other correlated things. So people in P3, the P3 group, who are 75 and older, are oldest, and the people in the P1 group are the youngest. I believe that's 50 and older. Could be wrong about that. P2 is 65 and older. And so what you're seeing in the diagram is the different factors that go into a model like this, with the things that you would need to know in order to estimate costs. So things like annual death rates, which give you a sense for how long people are expected to live after we install the home mods. Once they're gone, home mods are not very useful, so we need to know that. So the mortality rate and life expectancy in years. We also need to know the fall rates, and as you can see, the annual fall rate we know increases the older people are, so that would go into the equation. Serious falls, or the share of falls that are serious falls, so these are things where people end up needing some sort of emergency care or hospital care, that goes into the equation. The number of falls that create costs. So there's lots of, it gets a little bit complex, more complex than we need to talk about here, but you get the idea that we're basically looking at all the variables that you would need in order to do a model. We've got some falls costs, which we can attribute to those falls rates and serious falls and falls resulting in costs numbers. And then we have a line for the cost of the home improvement. And I believe that's the estimate here is if we spent $4,400 on each case, and that is an average. Of course, some are going to be much more than that, and most are going to be much less than that. We've got some other figures about the baseline annual rate of home mods, falls reduction from intervention after 65. So that refers to the different studies that I was just alluding to, finding different rates of falls. So they modeled this for different assumptions. If we assume that home mods reduce falls by 20%, and if we assume that home mods reduce falls by 40%. So we've got some different estimates for that. And then lastly, there are some figures showing what happens if the government shares different levels. So for example, if they just put 100% of the costs of the $4,000 for all eligible cases, and then they estimated for lesser amounts as well. And so you can see the results here. It turns out that if the government funds 100% of the costs for cases, then we never recoup the entire costs. It turns out that that would not be possible to save or to recoup our costs if we paid for everyone's home mods. For people age 75 and older, however, if we paid 50% of the home modification costs, then that investment would be recouped within 10 years, which is promising. We want people to live long lives independently. And if they live 10 years, then we know that their costs will be recouped and potentially make a profit. Actually, I shouldn't say that. I don't know that that's true, but we know that the cost would be basically zero sum after a 10-year period. And for those 65 and older, if we paid 20% of the costs, then the cost would be recouped in 8 years. So it looks really promising that this is not necessarily just a shell out to people that would obviously make their lives better, but also that the government can make a return, essentially, that it's not just all one directional. So we've been looking at Capable as a model. Many of you, if you were at our last meeting, are already aware of this, but Capable is a program that involves a 4-month intervention that includes registered nurses, occupational therapists, and then a handy person who comes in and makes sure that the home mods are done correctly and safely. On average, the costs of this program are up to $4,000 per case, so consistent with the other numbers that I just showed you. And the idea here is to prevent falls and to improve ADL and IADL functioning. And so many studies have been done. I'm going to skip a slide here and show you this. Many studies have shown that this is a good program. The evidence base shows that this is efficacious for doing the things that it tries to do. You can see a improvement in ADL limitations and IADL limitations by the vast majority of people who participate. There are also benefits to mental health. It's not shown here, but we know that cases of depression are reduced for all the reasons that you can probably imagine. Connections to being independent and feeling like you're taking care of yourself all can impact your mental health as well as your physical health. And then I think more importantly is the lower right-hand corner of the slide, which is showing a comparison of those who receive the Capable intervention with those who are matched for their functioning, but don't receive the intervention. And so the costs that are shown here are savings to the Medicare program. And you can see that there are significant cost savings for those in the Capable program versus those outside of the Capable program. And that is why Medicare, some Medicare will pay for aspects of the Capable program. So this is one of the reasons that we're interested in bringing Capable to Wyoming, so that we can maybe get some public funding as well as other sources of funding as well. And then back to my slide on Medicaid, all states have the option to have waivers that they can use to improve problems that they think are worthy of focus. Recently, we talked with our Medicaid group about home and community-based services here in Wyoming, and it turns out that they very clearly can see our vision. They're not able to commit to anything at this point because of those waivers go in cycles, and they just renewed their cycle. And so we may be a few years off for that, but we definitely have, I think, acquired an ally, and hopefully we can continue working with Medicaid and other programs as we're moving forward. So I think, yep, that's my spiel. And I thank you for listening. And I also will take questions if you have any.
I have a question, and Bernard, I've talked with you about this before. I think it might be really useful to have some of these modifications built directly into housing right from the start. And I see that Trevet is on here too, and I think I'm talking about universal design. And if it really is so cost effective, then wouldn't it be good to advocate that policymakers require this in building codes for these? Because as you said, these modifications can be helpful to people of younger ages and also people who are younger but have some sort of disability. So that's my question.
Yeah, that's a great question. So in our regular presentation, we show a photograph of a house that I always imagine was built in the 40s. And there's, of course, much of our housing stock is not new and is not designed well for people who are aging in place or trying to age in place. So we make the distinction. We think of home mods as being just what the title is, modifying a structure that already exists. And so that's sort of our target area, but I definitely would agree with you that if we can get things designed right, because the aging of the population is going to continue for decades, the rest of my life for sure. I'm one of them actually. And so, right, if you can design well from the beginning to make an environment that will function for everybody, regardless of their functioning, their size, their shape, their abilities, then that's a better approach than building the way that we used to build. And hopefully there's some of that going on. I don't think houses are necessarily strictly built to universal design regulations, but hopefully people are aware, and maybe a bigger part of our goals needs to be raising awareness that this is really important, that we just can't continue to build without consideration for the people that are going to be using the housing.
So that takes some advocacy to cities or counties, policymakers, or whatever is the best approach.
Policymakers, we're trying to get the word out. We've been presenting to senior centers and really kind of have big plans to spread the word. But I think maybe some work with your group, Jenny, the Healthy Aging Coalition, would be an approach to that as well. But environments really need to be taken into account, because one's functioning is very greatly dependent on where they are and the environments that they live in.
Yeah.
So,
Jenny,
and anybody can see that. It's not like this is controversial. It's just that awareness needs to be raised.
I think Treva was trying to say something.
oh, I can answer part of your question. So some things could be part of a building code, like say, we need to have a bedroom on the first, like the first level or something like that, or a bathroom with a shower on the first level could potentially be. But part of the problem is not all lots are the same. So you can't build the same kind of universal design house based on different lots and things like that. So you have to be careful how you put it in the code, is my understanding. And you can't just have a walk up on every lot. Like you have to, a lot of lots would require stairs and so on. So that's one of the difficulties in trying to codify everything, is you have to think about all of the possibilities out there. So.
And couldn't you take the parts of this that really are universally applicable, such as the bathroom, modifications, and so part of it might be applicable to all lots.
Sure.
Okay.
Thanks. And Darlene from Memorial Hospital Carbon says that it would be great if it was a mandatory building requirement, and I think I completely agree. If there was some kind of universal design put in, that would really help. So thank you for those comments, and Jenny, thank you for yours as well. I think this is a really interesting area, and Trevor, I think this may be a future slide, a quarterly meeting agenda that we can go over this in more depth, because I feel like this is there's some value in here for a longer discussion. I think.
Maybe
Absolutely.
the vulnerable adult working group could have some focus on this.
Yeah, and Trevor, we can let you know about that group and how to connect with us there.
Sure, I'd appreciate it. Thank you.
Thank you.
That's why we invited you, Treva, and Ginny too. You know, you have knowledge.
Yep. Thank you.
Wonderful. Well, thank you, everybody. And if there's any more questions on universal design or any other features that Bernard was going over with the financial benefits, Medicaid, and so on, then please feel free to mention them now or in the, later on in the question and answer feature. So we'll be moving on now to a presentation by our very own Katie Sloan, who is a part of WYCO and also a student at the University of Wyoming. You can introduce yourself as well if there's anything I may have missed there, Katie, but let me just present your slide deck, and she will be going over all of the funding sources and programs that we currently are aware of for home modifications in the state. So
thanks for sharing your screen for me, Mark. I appreciate it.
welcome.
So I am Katie Sloan. I'm a BSW student at the University of Wyoming, and I've been interning at the Wyoming Center on Aging. And a great part of the project that I've been up to is to locate some funding resources for home modifications, both national and statewide. So we wanted to share these, and you know, some of these programs have different requirements. There's many different qualifiers for funding programs. While some may have an age requirement, others may serve individuals with disabilities, and others may have income requirements. So we wanted to build a comprehensive list that people in Wyoming could access. And regardless, there is a need. And so now there's some choices, and hopefully we can help people maintain their independence and live comfortably in their home. At the end of the presentation, there are a couple of slides that have contact information for all of the agencies and people we have located that are able to be the contact for those groups. And if you were a member of any of the agencies that I mentioned, please feel free to chime in at any time if there's something that you'd like me to mention or include in this presentation for the future. If you don't mind progressing, Mark. Thank you. So the housing stability services through ERAP, to qualify for housing stability services, the individual must be approved for ERAP through DFS already. Adults with disabilities and adults older, or excuse me, those with disabilities and adults older than 55 qualify for this program. And they may receive up to $5,000 for a home modification. And that also includes trailer and mobile home repairs. And I think this is a really good program. And I couldn't remember, Mark, of how long you said this program had been extended for. So I'll have to include that eventually.
Yeah, so we definitely have funded until September. That's guaranteed. And we are trying to secure an extra 2 years, and we're almost there, but there's no official, yes, we have that yet. But we're looking at 2024, 2025 before this funding runs out for the emergency rental assistance program.
Is there any danger of just the full amount running out, or like, do you think you could provide as many home mods as we're interested?
Yeah, there's no danger of it running out anytime soon. Anybody who is eligible and applies, they're going to have funding for it. So
yeah, we really need to promote that, as you know.
Absolutely. Yeah, it's
a great program to be able to spend those funds. So those who qualify, they've qualified through DFS for any combination of the following assistance for rentals, utilities, or broadband service. And yeah, terrific program, and hopefully we can keep that going. So the National Family Caregiver Program with Title III-E. This program allows people to get up to $400 for a home modification. They must live in a county in Wyoming served by the Family Caregiver Program, and also must be a caregiver of an older adult or child. So we could build in the list of counties served, I think.
Yeah.
I remember, how many counties did we say this is serving at the moment?
Oh, I don't think it's all 23. Jeff, do you have the actual number, Jeff Clark?
I think right now we're currently serving 15 of the counties. And for a specific list, you could find that on our website. And I can probably provide a link here if that would be helpful for everybody, where to find that.
Thanks, Jeff. You can put that in the chat and people can see
Yeah, definitely.
where that goes. And also on this slide deck, which is not live on the website yet, but it will be at some point. These all have hyperlinks that will take you to the page with the list of counties, and every slide has that hyperlink on it for the program equivalent.
Perfect. All right. Let's move forward. So we wanted to mention the Section 504, the USDA loan, as a lending opportunity for those. It's not just a full funding opportunity, but there are lending opportunities as well that we want to mention. So for the Section 504, you can get a loan up to $25,000, and there are grants up to $7,500. You must be the homeowner for the lending and grant opportunity in an area with less than 20,000 people. So this is an effective program that could help those in really smaller towns, really rural areas. I know that Rick was talking about, those that maybe live on a ranch or farm. Maybe this is opportunity to help with some of those home repairs that they might need. If they receive a grant, they must live there for at least 3 years, or they will have to repay the amount given. And the person applying must not be able to obtain credit elsewhere. I think they have to exhaust other options before they would qualify for the Section 504. The family income requirements, 50% below the median income for the area. And I can link that as well, so people can double check to see if their income would qualify. All right. Am I moving forward, Mark? Excuse me. Volunteers of America. There's going to be opportunity for home mods and repairs for older adults through this program. The application must be submitted by a qualifying person or agency, and there are income guidelines. And I believe that I need to get some more information about this program, but if anyone has anything they would like to add to this, please let me know, or you can email me about this program, but must be submitted by a qualifying person or agency, and then I think they determine what you would qualify for based on income guidelines. So the LIEAP and weather assistance programs, they will be able to provide some weatherization for homes of those with lower income. I think while they're not super intense home mods that would be grab bars and things like that, it does provide comfort to homes and make them more energy efficient, which is something older adults need. So I felt like it was important to mention this program. It's an excellent resource for older adults, especially in Wyoming, where we have long and tough winters. And you can qualify if you've already been approved through LIEAP, and there are income guidelines for that program, which we can link as well. And there is an application on the website for those that are interested. Veterans benefits. There are a couple of different programs and grants that they offer. The specially adapted housing grant and the special home adaptation. And for those, you must own the home and have a qualifying service-connected disability. There is a link in there that would list those qualifying disabilities. So, and it would let you know right away if you would qualify for that type. So if you do qualify for the specially adapted housing grant, you can get up to $101,754 for this year. And that's the current total maximum allowed for that. If you qualify for the special home adaptation, you may receive up to $20,387. So it's a good amount that is delegated to being able to improve your home or do home modifications. but the service-connected disabilities would, they're very specific. So if you do qualify for either of those, you also may receive a temporary residence adaptation grant. And that means if you're living with someone, a family member, and you need to make changes within their home to meet your needs, you can apply for that grant as well. So yeah, it's please make sure to, you know, direct people to look at those service-connected disabilities. It's really important to see what they would qualify for before sending them over that way.
So I think there's a comment from Rick Geringer in the chat saying the 504 home improvement loan grant recently increased the amount to 10,000 for grant and I believe 35,000 for loans. So
thank you for that, Rick. That's wonderful.
thank you, Rick. I'll move forward for you, Katie.
And I can update that. Perfect. All right, so WyHelp is a Wyoming nonprofit that is a DBA of Goshen Help. And I've explored this website, and it's an amazing resource for many different things, but for home modifications, they can help with ramps, appliance repairs, grab bars, and much more. There is an income requirement, and they serve 6 counties right now in Wyoming. And there are applications and more information on the website for those interested. This link in the slide would take you to a list of income requirements for, you know, single people, and then the number of the family. So it's really helpful, and they make the process. I believe you can apply online and submit all your documentation just through their website, which is really helpful. But seems to be a really great program serving Carbon, Crook, Goshen, Niobrara, Washakie, and Weston counties. Wyoming Cares, a nonprofit that can help with funding towards needs and its temporary assistance. The applications are reviewed monthly, and they must be submitted by a case management service. They have fundraisers, they do donation based, so all of their applications are reviewed monthly, and then they will determine if a person qualifies. I believe it just depends on what your need is, and they can hopefully get the client some funding. The Travis Roy Foundation, they can assist with adaptive equipment and technology and home modifications for quadriplegics and paraplegics. The applicant must be paralyzed from spinal cord injury to qualify and have financial need. They will ask you to provide financial documentation, taxes, benefit verification letters, and all those things, and hopefully be able to help others move forward.
Okay.
Thank you, Mark. Wyoming Home Services Program, home modifications up to $300 per applicant per year. They do have other services such as care coordination, personal care, and adult daycare, but for home mods, they would supply up to $300. For eligibility, a client must be 18 or older, and through ongoing evaluation, be at risk of premature institutionalization. And I believe the WISE program, this program, it's not available in every county. So I think we need to list perhaps what county that's available in.
That's right. And so there is applications live right now for more providers moving forward. So we may well get that every county filled in. But most counties do have a service provider, I would say.
Perfect. Thank you, Mark. Developmental and disabilities waiver through Medicaid. So this would allow environmental modifications, including physical adaptations to the private residence of the participant or the participant's family. And it can include new items and repairs. I know that we have talked a little bit about this, so hopefully in the future, there may be other Medicaid waivers that could provide environmental modifications that would provide a more broad access to people in Wyoming. I know Mark and Bernard and Kristen have been working to create that awareness for not only for WyHMAC, but for anything, because we clearly see the need of how badly people are in need of the home modifications. So in order to qualify, they would have already been under the DD waiver, and they probably had been for a long time, and case management can help do the coordination for a home environmental modification.
Thank you. And just to add, so Medicaid does, they do these home modifications, but it's for that specific subset of our population who have those lifelong disabilities, learning disabilities, and developmental disabilities. And I think there's about up to 20,000 per person. Don't know if that's annually or if that's over the entire period on the program. And what we're trying to achieve is the community choice waiver inclusion of home modifications, which will just widen it up to many, many more people. But they do home modifications and they have their allotment right now, and that's a really good thing. So just wanted to make that distinction. Basically, Katie.
Thank you, Mark.
If there's no more questions, we can move this one forward for you.
Wyoming Independent Living, they're able to do home modifications for tangible projects like ramps and bathroom modifications. Wyoming Independent Living serves the eastern portion of the state, so Sheridan, Johnson, Campbell, Crook, etc. And it's for individuals with long-term disabilities or medical conditions that hinder at least one activity of daily living, and those who will qualify for Wyoming Independent Living services. Excuse me. And Wyoming Services for Independent Living, which is, I'm not sure if they're the same organization and they call themselves different. I believe it is, right? But these guys will serve the western portion of the state. And they do tangible projects as well, like ramps and bathroom modifications. And Uinta, Lincoln, Sweetwater, etc. They'll be on that half of the state. And individuals with long-term disabilities, medical conditions that hinder at least one activity of daily living. And Wyoming Technology Access Program. Rick mentioned this program earlier in regard to the AgrAbility. That maybe these a program like this lending program could help people who need larger projects done, larger scale. So it's a lending program that will offer those with disabilities the opportunity to finance some assistive technology. YTAP buys down the interest of the loan, and recipients can receive up to $25,000 for adaptive technology projects, which is this is a really great program. And then it's in conjunction with Interstate Bank of Laramie. So they have Wyoming Independent Living and Interstate Bank, and they're all coordinating together to offer this lending opportunity. To receive an application packet, you can do that through Wyoming Independent Living, or you can follow the link or email them and see what other information is required for that application. And I believe we just have one more. And that was the YRAMP program, and I believe they supply temporary ramps, increasing safety and access for a person's home. They are located, they're right now serving Lander, Laramie, and Torrington, And it's a collaboration between Wyoming Assistive Technology Resources and Wyoming Life Resource Center and the Goshen County Senior Friendship Center. So those in need of a temporary ramp can apply for this program. There's a link right there that would direct you to their website.
It's just at the top, just as a reminder to people to click on that if you have the PDF copy, which will go live very shortly.
And we also just wanted to mention a couple of different resources that are lending opportunities through housing and urban development. There's a Title I home improvement loan, which insures loans for rehabilitating an existing home. Or there is the 203K rehab mortgage insurance, which enables homeowners to finance the rehabilitation of their existing home. There's also different resources that a person may take from their private financial institution, like a home equity line of credit, where they can borrow money that is repaid with interest, and the homeowner's residence is used as collateral. There's also the home improvement loan, and it just depends. Interest rates will always depend on your own financial institution, or you can, there's second mortgage to finance the home mod. And it's repaid in addition to the existing first mortgage. So if you have older adults that are on a limited income, this might be feasible, might not be feasible. So, but these are just opportunities for people who really need something done and may not qualify for the other programs. And then at the end here, we have a list of the program and who the contact would be for that program. And this will be a work in progress over time as things come and go. Hopefully we see more additions than subtractions to this list. And if you guys have any questions or know of any more programs that should be included, please feel free to email me. I'll put my email address right in the chat. And if there's any questions, I'm happy to answer.
Thank you. I just put up the second screen with the rest of the links there, which if anybody is looking for one right now, feel free to write them down. If you don't have time to note it down, just contact us and we'll send you it, or we can put it in the chat before the end of this meeting as well. Rick just wanted to clarify that the separate independent living centers will just cover two halves of the state, basically. Two separate, but they're like a sister connection. Obviously, the two organizations are connected there. Thank you, Katie, for putting your slides up here. And
yeah, thank you, Mark.
So we still have 15 minutes left of our quarterly meeting today. And again, feel free, your questions and comments are welcomed. It enables our discussion to be more tailored for what you want and what you're looking at as well. But we do have another section now with Kristen, if you are back on. If you're on still, sorry. I believe the next section is yours with Dan, if I'm not mistaken.
Yes, so we can go over some of the document that Dan and I put together for hiring a contractor. This is back. Let me share the screen.
You want to share? Okay, that's good.
Oops. Can you all see the PDF? Okay,
yeah,
great. So this is just a helpful document that we worked on putting together to help people when hiring a contractor. So part of the goal of WyHMAC was to build a repository of information, right? And so with that, and getting contractors, we're working to put together a larger list of resources. But this is just a helpful tips to help people more easily parse through who they're working with and what they should be looking for when they're, getting whether it's a small job or a large job, who might be the best person. So along with informational flyers like this, we're also working to build just some massive database of different contractors who are willing to perform home modifications around the state. So that's definitely a work in progress. There are a lot of individuals, but with a wide variety of backgrounds. And so one of the larger projects that we've been working on is just parsing through that list and paring it down for people who are actually interested and reliable for doing smaller home modifications. I think oftentimes it's a limiting factor that the jobs are smaller and they might, pay a little bit less. So it's harder to nail down people, pun intended. But they nonetheless are good jobs, and there's definitely a need for them. So we're just working on finding people who will, do home modifications and focus on this area. So yeah, if you have any connections or names of people, we're always taking information down. But this is, for the most part, what we've been working with so far. I'll keep it short and simple, just as we're running out of time. I mean, I don't think you want to see the entire spreadsheet.
I wanted to mention that, so one of the things that we've been doing is making informational documents like this that we're compiling on our website, as you saw earlier. And we recently have been doing some grant writing to try to get funding to print these things out and to distribute them to the places that we are presenting. So if there are senior center administrators on the call, we would be delighted to present for you via Zoom, most likely. And then also we would provide you with copies of these things for you to distribute, assuming we get our funding. But presentations are on, so if you are interested in a presentation, then we would like to do that.
I have a question about the contractors.
Mhm.
So is it a requirement that you guys are requiring that we have contractors? Because it doesn't seem to be under HSS a requirement by the state.
Probably Dan can answer that better, but I would say an issue that we're concerned about, and we can't require anyone to do anything, but an issue that we're concerned about is that there are contractors, there are even contractors out there who don't know necessarily the proper way to install home mods. And so I think that's what we're really interested in, is that they know, I mean, everyone knows not to, most contractors would know not to screw into just a wall and you need to go into a stud. But there are things about height. Sometimes they may assume that this is an ADA thing, when really what we want people to understand is that this needs to be specialized to the individual. And so there are just little idiosyncrasies like that that maybe pertain to home modifications specifically and not to just contracting generally, that I think we want to ensure happens. If they're not done safely, then you can actually put people at greater risk. So that's really our main thing.
Sure, I understand that. But when we live in smaller rural communities and we can't get the contractors to make the modifications, like you were saying before, it's difficult because under the HSS grant that we just wrote, we can just ask for those modifications ourselves and build them through HSS, which might eventually take you guys out of the loop because your requirements are more stringent than what the state is actually putting on us.
So, Amy, that may be a question more for me and you to talk about. And if it's, are you talking about the IRAP HSS?
Yes,
Yeah.
yeah.
So obviously with HSS, there is room for looking at improvements for September when we have a new grant agreement with DFS, and we can look to modernize and improve things. And all of your advice and information about what's working and what's not will be welcome. So please send it my way so I can sort of evaluate all of that. So yeah, so I think that probably we'll take this in a different direction, just the two of us and Jeff Clark, of course, and we'll see what we can do.
Okay, thank you.
No? So, any more questions on home modifications and the Contractors Guidelines documents, which Kristen and Dan made and Kristen presented? So that is a large project. That is a project which will be it will never stop. There always will be a need for lists of approved and valued contractors, and when eventually we find a way to present that on the website, they will be available. But that is still ongoing work, and their efforts are very much appreciated. And we will let you know, hopefully in due course, and next quarterly or next after that, if there's any major movements forward with that project, and online, of course, for you to access. So thank you both for that. And for our last section, it's simply a question and answer. If there are no questions that you want on the recording, we can. There is one question in the chat. Let me just read that a second. Yeah, so Josh, we can definitely. It sounds like that's another IRAP HSS question. We can talk through how those requirements work and what we need for the HSS as well. It is, I suppose, being a program manager for a home modification program as well, and seeing what it's like out in the field with our counties and our rural locations. This information is very crucial because we want it to work, but we want it to be safe, and we want it to everybody to be happy with it, from the state down to the client and everybody in between with our providers as well. So this is definitely a partnership and a collaboration. So we welcome updates. So yeah, send me an email. We'll set up a meeting and we'll talk about that for sure as well.
That is a really interesting issue and barrier that I think is specific to Wyoming, is this lack of qualified providers, especially in the extremely rural parts of the state. Not only with respect to contractors, but also with respect to the OTs and those providing medical assessments. Sometimes just the lack of people is preventing people access, the distances that people have to drive. So one of the things that we're working on is some research to look at these specific barriers and possible solutions to these barriers. So we have lots going on, I think, in terms of these types of issues.
Because we know there is a financial burden to getting licenses in different county seats and city authorities. You know, I've heard licenses can cost up to $200 a year, which is no small chunk of change when the profit margins per job are not that large, and you have to pay workers and materials that are going up and so on. So there is definitely a discussion needs to be had, because we need to find a way that works for Wyoming, and these sessions and our providers out in the field, and you working with local contractors, we need more information, we need more feedback from y'all, and we may well be sending out surveys in the future in order to sort of gather some of that in. But feel free to just send a cold email and just send it to one of us, and all of our details are on the website for WyHMAC. And you can email any one of us and we'll sort of relay it to the team, what's new. So yeah, this is a constant project. I think this is something that will continue to grow, is how do we engage our contracting community? What's the best way? Because at the end of the day, we do need to make sure that they know and are experienced with home modifications. That is important. I don't think that would ever change, but is licensure necessarily the best approach? That's a question, and we can certainly discuss that, I think. So, okay, so if there's no more questions in this part, I will stop the recording. And thank you everybody for joining us at WyHMAC. The recording portion will be stopped now, and there'll be a Q&A just after this for anybody else.